Well, you hear people with the sniffles all the time, struggling to breathe. We've all had that problem. But many of those people have sinus problems and not just a winter cold. Well, in tonight's 5 o'clock Health Watch, Health and Science editor Earl Ubell has word of some new surgery that's easing a lot of stuffy heads.
Mr. Rittenberg, I'm going to put a little spray in your nose.
Every year, nearly 34 million Americans suffer from chronic sinus problems. Every year, they spend more than $1.5 billion trying to breathe easier. Jerry Rittenberg, a manufacturing executive, was one of them.
It's very clogged up, had a lot of pressure, very tired, not a lot of energy, very congested.
Mr. Rittenberg even had an operation which gave him a massive infection and made his sinus condition worse. He finally found Dr. Jordan Josephson of Maimonides Medical Center in Brooklyn, one of a handful of nose specialists who perform what is called endoscopic nasal surgery. It cleans out infected sinuses, removing polyps, corrects deviated septums, all through a tiny fiber optic tube inserted in the nose. No incisions necessary.
Now, the little tissue straight ahead is what we call the middle turbinate, which is the tissue that's responsible for filtering, vaporizing, and heating the air that reaches your lungs.
For the patient, the advantage is obvious. Just ask Chaim Green, who had 3 conventional surgeries before this new procedure.
After the operation, there is a different world what was before. I mean, I'm open, no swellings inside, and I can breathe.
Endoscopic surgery helped 5-year-old Michelle Mizrahi when other treatments had failed.
I went to one ENT doctor, and he put tubes into her ears and removed the adenoids, and it never got better. If anything, it got worse.
Michelle, who is asthmatic, now breathes better too.
Very often, sinus disease leads to lung problems like asthma or bronchitis because the mucus that the sinuses produce from chronic inflammation trips back into the lungs and then aggravates the lungs, either worsening the asthma or worsening the bronchitis.
Who helped you?
You don't have to suffer with your sinuses. Medicines often work, but if your infection is chronic, this new surgery can help. With tonight's 5 o'clock Health Watch, I'm Earl Ubell, Channel 2 News.
Time now for a look at some of the stories coming up on Channel 2 News at 6 o'clock, and Michelle.